So tell me a little bit more about other stuff that's going on in your pharmacy. I know on your website, you have a section about LDN.
Yes. We one of our locations is a PCAB accredited compounding pharmacy, and one of the opportunities we've had has been to do education for patients in non-traditional treatment methods. And we've seen some patients that really have had some success with low dose naltrexone. It's a product that's been on the market for decades. It's well studied, it's safe, it's got a low side effect profile when used in lower doses. And, it was something that Dr. Bernard Bahari discovered by accident when he was dealing with patients that had chronic diseases like HIV and AIDS. He found that it boosted endorphins, and it was one of those things that patients with HIV and AIDS and chronic disease had lower endorphin levels. And that seemed to be one of the many mechanisms that seemed to help them cope with different pain or autoimmune conditions. So LDN has been kind of a passion project for us in the last year and a half. We've worked really hard to educate patients and providers. And patients that have used it are excited because it's not a narcotic. It's not going to be a dependency issue. And it really seems to help them get control of their life back if it meets their profile. And it could be any number of things. It could be fibromyalgia. It could be irritable bowel syndrome. It could be chronic pain. So that's fun. It's been something that I really enjoy, the ability to help patients solve problems with our compounding lab, whether it be someone who just had surgery or a little child who was born premature and has a heart condition. I mean, those patients are a different kind of patient that have nowhere else to turn in our community. And it's been really rewarding to work with them and learn in the process. So we really value that relationship we have, and we're looking to expand our non-sterile compounding lab facilities very soon.
Yeah, so were you guys compounding kind of from the beginning, or was that something that you guys dove into recently?
No, we've been actively compounding since about 2004. So it sounds like so long ago, but it was one of those things that we kind of flirted with and thought, well, do we want to spend all this money to get geared up? And, by the time you buy your powder containment hoods and your special facilities and equipment, it's not a cheap endeavor, but it's really nice because whether it be a man or woman who's dealing with a hormone replacement therapy or like a child that has a cardiac issue, it's neat because we kind of have a different patient bond, as you alluded to earlier, with a patient who knows they can't get this from Eli Lilly. They can't get it from Merck. I mean, it's something that's customized to them. It may be customized because they can't swallow. They may have a red dye allergy or something like that. So that's been really exciting.
Yeah, that's one of the things that seems kind of crazy if you think about it, is that medicine is kind of a one-size-fits-all for most medications. One of the upcoming podcasts we're going to have is with the GuidePoint team up there in Minnesota, and we're going to talk about personalized medicine. Where do you see that going? Do you see that coming into your pharmacy? It seems like it's the year 2021. We should have medicine that's tailored for our chemistry.
I totally agree. And there are things out there now that'll blow your mind. I mean, I have a colleague that actually has a 3D printer that can print medication in certain doses and dosage forms. And I mean, I think our opportunities for customized medication are endless. It just depends on if it's done in a fashion that's responsible and isn't going to be abused. I mean, we all know about the NECC situation where there were patients that were harmed because of greed and carelessness. And that's a huge thing we continue to try to overcome on a regular basis because somebody did something bad and hurt people. But in general, I want to believe that the compounding pharmacies and pharmacists out there are out to help their patients. They're not looking for world domination. They're looking to help their community. And I really think that when you think about COVID vaccines, for lack of a better thing, how is it that every person from 18 to 99 gets the same dose? It's kind of strange when you think about stuff like that, whether you're
Right.
80 pounds or 480 pounds. So I think we're going to see more, and we already are with some of the specialty meds, seeing a lot more specialty doses. It's just those things are so expensive, and generally compounded medications are more affordable.
Yeah, it is. It is interesting that there are shoe stores that go in and take so much care to tailor a shoe, to something that's going to fit your body well. And I don't know. It seems like there's a lot of opportunity there with compounding. Thanks for listening to this clip from Beyond the Scripts, presented by the Catalyst Pharmacy Podcast. If you enjoyed this episode, please support our channel by liking, subscribing, and clicking the notification bell so that you'll be notified anytime we post new content. To stay up to date with all of the latest independent pharmacy news and content, follow PioneerRx on your preferred social media platform.